Well, that week, Adrian just detailed, changed life in Canada, leading to an incredibly difficult 5 weeks. And you have had lots of questions about COVID-19 in that time. We have been answering as many of those questions as possible each and every night, and we're going to continue to do so. Tonight, we're asking your big picture questions. Where are we with the pandemic, and when will life get easier? Joining us now, Dr. Taslim Nimji, an ER physician, and Dr. Isaac Bogosh, an infectious diseases specialist. Hello to the two of you. Dr. Nimji, first question goes to you, particularly because of your work in a hospital. It seems hospitals aren't seeing the surge many were fearing. Where is your anxiety level now about our healthcare system getting overwhelmed?
You're certainly right that we are breathing a little bit more easily today than we were 6 weeks ago when all of this really hit and started. To say that anxiety levels have dropped dramatically would be an overstatement. I think they're certainly not as high as they were before. And you're right that there are some that are speculating that, we may actually be at peak, and we're certainly not seeing those exponential curves that we were dreading. And there is capacity in the system to deal with the influx that we're getting at this point. However, we have to be cautious because you don't want to start peeling back some of the measures both in the community and within the hospitals. And by the ones within the hospitals, I mean, really sort of holding back on surgeries, elective surgeries, as well as some of the other surgeries that we are not doing at this time that we would certainly like to do and not hold off indefinitely. But we have to be very careful to sort of very strategically and methodically look at how we can reintroduce some of that with the capacity that we have, so that we don't do the exact opposite of what we've gained here in terms of not then really sort of overwhelming the system.
Right, because how beneficial is more time? I mean, if Canadians continue to be on good behavior, what does that buy you?
It buys us a lot, and it's very beneficial. We still have a lot that we need to understand in terms of serologic testing, how much of our population is actually immune. For example, if we start really repealing those measures very quickly and having people start re-entering society again as they would have before, we still really run the risk of having a lot of people getting sick very quickly. So there's still a lot of pieces that we need to put together here, including really ramping up our testing, looking at serologic testing, and all of that when we're actually looking at how we can do this carefully.
Okay. Dr. Bogosh, is finding a vaccine the only thing that will make things mostly normal again?
Sadly, I think the vaccine is really our durable way out of this situation. And, we know that that's going to be at least, 12 to 18 months in the future. But without an effective vaccine, I don't think this virus is really going to go away anytime soon. And, we might see places where there's spikes of it. We might see places that might have lower levels of transmission as time goes on, but it's not going to disappear. And unfortunately, we really need to pour all our efforts into having an effective vaccine to really get this under control so we can return to life as we remember before.
And I've heard an awful lot from seniors, from immunocompromised people who feel like they're under house arrest until a vaccine comes out because they have too much at stake. That's going to continue to be true?
Sadly, I mean, we know that those individuals, certainly the population over the age of 60 and people with underlying medical conditions, including people who have suppressed immune systems, these individuals are at greatest risk of having a poor outcome from this infection. And, in the pre-vaccine era, there's only so much we can do, right? How do we protect these individuals from getting this infection? So, sadly, it comes down to physical distancing measures and really setting up policies in place to ensure that individuals who are at risk of having the greatest chance of having a severe outcome just don't come into contact and don't get infected with this. It's hard to do.
Right.
And truly, a vaccine is our way out of this.
Dr. Nimji, what concrete sign are you looking for that might signal we're beating this thing?
Everyone's looking for a sign. We all are, but really, again, this goes back to it being so complex and needing multiple pieces of the puzzle to really come together. And part of that is, as Dr. Bogosh was just talking about, is having a vaccine so that we can then look at moving forward and actually looking in the rearview mirror at this, as opposed to being smack in the middle of it. But certainly to be able to see a decrease in hospital admissions, a decrease in case fatalities, combined with a high degree of immunity in your population, because through rigorous testing and serologic testing that you've come to that point, I think then you can start to breathe a lot more easily than you can right now.
Dr. Bogosh, you see things the same way?
Yeah, I mean, we really need to see a lot of things fall into place before we see life slowly return back to normal. That includes really ensuring that there's a reduction in the number of new cases per day, fewer hospitalizations, and fewer use of hospital resources related to COVID-19. there's a lot of different metrics we can follow that will tell us that we're headed in the right direction.
Dr. Bogosh, Dr. Nimji, I learn a lot every single time I talk to you, and tonight was no exception. Thank you so much for your time.
Thanks, Andrew.
Have a great night.